So I think we should start now. Vijay, would you please display the PowerPoint? All right, thank you everyone for joining in our webinar today. This is our 11th webinar so far. So just to give you a brief introduction of what SACYN is, we stand for South Asia Christian Youth Network, and the network was established in the year of 2002. So till now we have youth leaders from 7 countries engaged in this network, and these countries are Bhutan, Bangladesh, India, Myanmar, Nepal, Pakistan, and Sri Lanka. So SACYN is all about inspiring, preparing, and strengthening young Christian adults to cross bridges, to encounter and share their faith and lives with those who are from different circumstances, faiths, language, and cultures, ethnicities, and nationalities. So before COVID, we were meeting annually, and we were conducting annual events in terms of conferences, leadership trainings, and core group meetings. So our last face-to-face meeting was in 2019, and since 2020, because of this pandemic, we have switched to this virtual platform, and we have been conducting these webinars to connect with leaders across this South Asia region, and we've been covering different topics so far. You can check our website for more details, or our YouTube channel and or our Facebook page. So today we are looking at COVID-19's impact on disability on people with disabilities. Vikas Adhikari from Nepal will be moderating the session, and we have a very great set of panelists with us. So over to you, Vikas Dai.
Thank you, Prasamsa. Good afternoon, and Jamisi from Nepal. 15% of the world population experience some form of disability, and disability prevalence is higher for developing countries. Persons with disabilities are more likely to experience diverse socioeconomic outcomes, such as less education, poor health outcomes, lower levels of employment, and higher poverty rates. South Asia is a unique geopolitical region covering 3.4% of the world's surface area and supporting 25% of the world's population. As we all believe, people working on the disability sector, that there should be more than 2.1% of the population of disability, what the data shows in the South Asian context. There should be more than 10% of disability in the South Asian context, but the data shows only 2.1%. So we see the lack of identification of a person with disabilities in the South Asian context. So we can see very clearly how much people with disabilities has been marginalized in our countries. As COVID-19 continues to have a wide-reaching impact across the globe, it is important to know how persons with disabilities are uniquely impacted by the pandemic, including health, education, supporting system for them, psychosocial support for the person with disabilities and their families. So to talk about these issues, we have 3 expert panelists with us. so that to whom we'll be talking and discussing about the impact of COVID-19 on persons with disabilities and their families. Let me introduce you. We have our expert panelist from Nepal, is a Bir Nepali sir. We have a more than 16 years experience of working in disability inclusion and community-based rehabilitation. He himself is a guardian of a child with autism. Currently, he is working in a United Mission to Nepal as a disability inclusion advisor and also a coordinating disability working group for of Association of International NGOs in Nepal. Our second panelist we have is Zubin Burgis, who works with Emmanuel Hospital Association as a deputy director, disability, and is involved with supporting disability program in rural North India. Trained as a development psychologist, she has been working with community-based rehabilitation program. She is part of the team that founded the Engage Disability India Network, a network that brings together churches, organizations, persons with disabilities, and their families. At last, we have our panelists, Reverend Stephen Arulam Palam. He is a priest, he is an ordained priest by the Church of Ceylon and serving as a lecturer at a theological college. He is the coordinator of the Asian Disability Advocacy Network and a prolific writer with 10 books published in his native language and one in English. So it is my great privilege to welcome our three panelists to talk on the impact of COVID-19 and disability in a South Asian context. So why don't we start with the questions? And the question is probably I would like to hear from three of our panelists, starting from Bir Nepali sir, Jubin Verghese, and our Reverend Stephen. What is the impact of COVID on persons with disabilities and their families that you have experienced, seen in the context of your own countries and also in the context of South Asia? Bir sir, would you like to?
Okay. First of all, thank you very much to entire this network team and especially to moderate because sir for this opportunity. Yeah, actually, because even though I have a long experience in the disability, but I learned much from my own family and from my own daughter. So to talk about the context about COVID situation in Nepal, in South Asia, actually persons with disability are excluded from the development trend already in various way because of the various barriers. We call the barriers, especially that the barriers such as that the physical and communication barriers, and the barriers because of people's attitude and mindset, and big barriers because of the system or the policies what is developed in the context. So, for example, lockdown. Now it started a lockdown, but because of lockdown, the person's disability or so many other peoples are excluded from the development or from the mainstreaming activities, and these types of system are excluding the persons with disability. So even by the way, in normal trend also, persons with disability are excluded in the development activities, but this COVID situation has increased this exclusion, and that has increased the more vulnerability to the person's disability. So that's why. So we that's why we are facing in Nepal, persons with disability are facing lots of exclusion and lots of vulnerability. So as a parents of a child with learning difficulties or a child of autism, and in my family we have faced lots of problems. So we have faced with lots of situations. So first point is that one is schooling. So disruption of the schooling in our family. We have tried to teach our daughters in our one way, in different way, but it's not possible like a school. So we have a with a group of people, we have started one school. My daughter was learning daily in the school, but because of this lockdown, school is closed. So with this child, it is actually difficult to conduct the virtual session as well. So because of this situation, we are not being able to continue the education of our child. That's why we could not continue the education. So, and the next point is that increase the fear and tension in the family. So uh, uh, my daughter is alone at the home, and we are trying to take care of her, but it's difficult to manage everything. So in the safety and health situation we could not manage. And the next point is that the tension raised in the family. So because of this, we whole family is affected. So in one data survey in Nepal, also we find that 8% of people with disabilities are living with the psychosocial problems. What the survey of persons with disability, the group of people have taken from the rapid assessment. So and this is the this is the situation. And the next point is that because of this situation, whole family is affected. In my family, I cannot continue my job as usual, and my wife was not able to continue her job, and she had a business, but we had to stop that business. And that's why in this way, actually in main 3 points, we are affected very very difficult way. That is one part is the schooling, disruption of the schooling activities, and because of the learning difficulties, the children are not being able to attend the uh, virtual classes. And the next point is that increase the tension and fear in the family. And next one is that affected directly to the livelihood of the families. And exactly that situation, what we found from the rapid assessment of the Nepal also. And these are the main concern, and we are affected from this COVID situation. So that has increased the vulnerability of the persons with disability, and mainly the risk of getting the COVID infection more rapidly, and risk of and the people with disability are excluded of getting that daily use or urgent use material. So now the research, now the rapid assessment say that 45% of PWD, persons with disability in Nepal, are in high need of that safety measures and treatment and devices, and these are in this way. As I am in now Kathmandu, in the capital of the Nepal, I'm managing this situation. But to talk about the entire country and the remote people, and they are actually in high need and uh, uh, in high need. That's why this is the area. This is the context in Nepal.
Thank you, Bir sir, for your insight. We'd like to request Jubin Verghese to share about what is the impact of COVID-19 on persons with disabilities and their families.
Thank you so much. I think I'm going to change the perspective a little and talk from the health sector perspective, if you don't mind. So I'm working in a COVID hospital. And as we set up our systems for COVID ward and for receiving patients and caring, one of the glaring gaps that came to us later was the fact that we didn't have systems in place to welcome people with disabilities and their families. So for example, and this happened to us, is a friend of ours who brought in their young son with who's on the autistic spectrum, and he was COVID positive. Now, it's hard enough for most people to go into the ward away from their families, surrounded by people who are dressed in PPE, and for them to make sense of what is happening. Now, for a young person who's on the spectrum, to go into a ward away from his family, away from routine. And so I mean, to be isolated really and be surrounded by people the young person can't make connections with at all. So we didn't have systems in place for welcoming people with intellectual disabilities or those on the spectrum, to provide systems where they could come in with their families, perhaps. If you go into most COVID hospitals, the families are not allowed in, right? So we had to then stop and think back about, okay, what systems can we put in place for them to come in? So that's one of those things that happened. The other thing that's again happened in our hospital is we had both parents test positive and come in, and we had to admit both of them because they needed oxygen support. Now they have 3 children. One of them has a disability. So they have to leave the children at home, and both the caregivers are with us. And they live away from their extended family. So they didn't have anybody else. And the community is afraid to go into their homes, no, because they've got this big poster in front of their house that says that they're COVID-19 positive. So nobody is willing to go in. And there are 3 children who need help. So those were things that we didn't consider, or perhaps we were just so busy putting systems in place that we didn't think that these realities would be some things that we would face. Just one final thing, and I'll finish, is we've also noticed, or we've recognized, that a lot of people who are on regular medication couldn't have access to medication easily. So for a lot of our children who are on convulsants or anti-seizure medications, or those who have psychosocial disabilities or mental illness, and they require regular medication. So access to medicines for them, especially with lockdown and difficulties getting. So we work in rural areas, so our people have to come from, travel 2-3 hours to get to a decent place where they can get good medicines. So, thinking about how do they access those medicines and how do we make medicines accessible to them? Those are some of the things that we have faced as we've worked here. Thanks.
Thank you. Thank you, Javeen. We'd like to hear from Reverend Stephen. Can you unmute it, please? Maybe our host can unmute for him. Yes. Yes, Reverend Stephen.
Hello, sir. Can you hear me?
Yes, we can clearly hear.
Thank you. Yeah, first of all, thank you very much for the great opportunity. I am Stephen, born in the northern part of Sri Lanka. When I was 9 months old, I had fever. Doctor gave wrong medicine that affected my nerves. So I had my sight gradually deteriorated. Then I am enjoying the blindness. So really that affects in our day-to-day lives. In the Sri Lankan context, the visually impaired people, they are going through a lot of issues and problems, very especially verbally, psychologically, and physically. Even within the family, the COVID-19 situation created uncertainty, fear, and also lack of relationship. That means for a visually impaired person, generally, they touch and see. This, especially the 1 meter distance issue, creating a problem here. And people, generally when they see us with YK, they come and help us. Now, because of the COVID situation, they are scared to come to us. When they see me, they ran away from the presence of us. So this is one of the problems and issues we are facing for a visually impaired person. Then when I go to shop, I would like to touch and see things. So I cannot see, I touch and see. So that is not allowed now. So that's another issue the COVID-19 created for the visually impaired people. And also another issue is coming out not from my personal family, it's the visual impact people, they are really professional in one area. The COVID-19 situation, they ask us to move to another area. For example, because of that, they are finding unemployment problem, their day-to-day lives. They are not used to the culture. So in Sri Lanka, the visual impact people or disabled people or person with disabilities, they receive $25 per month. That is not enough at all. Even that's not enough for their medical facilities as well. Due to this pandemic situation, there are three phrases generally the government use. One, the curfew. Second, lockdown. Third, restriction of the traveling. All three are same, but that's really creating unpleasant situation for the person with disabilities. But it's especially the speaking impaired people, they used to wear mask. So, and also for an example, generally when they see people, they come closer and write something in their hands. That's the way they communicate. So I found a person, so unable because of this mask, and also is unable to find another person to communicate things. For an example, the lip speaking, generally they identify when they see the speaking impaired people, generally they observe. And also there's another issue creating within the family, generally the deaf people or visual impaired people. When the electricity goes, they are unable to communicate things. That created a lot of tension within the family. Even when they speak about economics issue, also creating another issue in Sri Lankan when we come to disability. For example, even when they see another mentally challenged people, they are also finding a lot of difficulties. There is no proper quarantine place for the person with disabilities. So quite a number of people affected in Sri Lanka. It's nearly 200,000 people affected. So there are a lot of disabled people also. No separate place for quarantine for these disabled people. So they should find their own places. They should find their own toilets. So it's a lot of difficulties for they are among the people, other people. So because of that, they are unable to survive. So I'm requesting, really they need to have a separate place, at least for their quarantine system. So in Sri Lanka, it's nearly 3 million people presently affected. More than 500,000 people lost their sight. More than 300,000 people lower vision. So therefore, this COVID-19 situation put us in trouble in many ways, within the family, outside the family as well.
Thank you, Reverend Stephen. Thank you, all our panelists. It really gives the sense, what are the problems the person with disabilities and their families are sensing. Like there is a tense, there is a fear, there is a psychosocial impact. Everything the people with disabilities and their families are facing during this time, during the COVID-19 impacted. I think we all are emotional hearing these things. I think it is hard to know. Maybe sometimes we cannot even imagine how persons with disabilities and their families are facing these things. We heard there has been a schooling problem. There is a lack of education. There is a lack of support. Even our healthcare systems doesn't have a proper system, or we didn't prepare early enough to adopt or to receive persons with disabilities in our system. So, as you all have gone through this problem, we'd like to know how you are coping with these situations, how you are solving these issues, how you are living your life with these issues, what's best practices that you are doing so that we can learn from all of you. So I'd like to start again through the Bir Nepali sir, then we'll go to the Juvin Verghese and the Reverend Stephen.
Okay, thank you, Vikas sir, again. Yeah, I would like to highlight here mainly the 3 points.
Sir, sound I know.
Can you hear me now? Can you hear me now? Hello?
Yes.
Can you hear me now? Hello?
Okay, why don't we hear from the Juvin right now, and while Bir sir will fix his microphone.
Yes.
I thought I had a few minutes to prepare before. Right. Okay, because like I mentioned earlier, because we were a COVID hospital, we've been primarily busy doing the medical aspect of care. But some of the other things that we've, through our partners, that what has happened is a lot of the local churches have adopted families with disabilities and providing, ensuring that families have provisions or, I don't know, just fresh supply of vegetables even, but just ensuring that provisions are available for families with disabilities, especially if they can't travel out, has been one of the things that a lot of the local churches have done. Some of the local churches have been involved with helping us provide medicines to families. So we create the kits for medicines, like I'd mentioned, medicines for those, say, with mental illness. So we create the kits and we hand it over to the volunteers from churches who in their communities will go in and give the medicines. Another great thing, which we've not personally practiced, but it's happened through the Engaged Disability Network and the leadership of the National Council of Churches of India, is they've looked at identifying volunteers in different regions, in different cities. So if there are people with disabilities who, for example, have to get to a place for vaccination, they can get in touch with the volunteers and the volunteers help them access the vaccination. So to go online, to register them on the website, to get an appointment for them and to get them to the place for vaccination have been things that volunteers have taken on through the Engaged Disability Network as well. So these are some of the things. I mean, basically the idea is how can we practically be hands and feet for those who need the support at that point in time. And that's what we've been doing. Thanks.
Reverend Stephen?
Yeah, as I mentioned, there are certain issues. The one area how are we responding is when we have got schools in Sri Lanka. So school for deaf and blind in Kaidari, school for deaf and blind in Ratmalana, that is in Colombo, another school in Walvagam in Jaffna. So it's a community basic programs is happening nowadays. So we bring disabled people together, person with disabilities, we give educations where they find their shelter as well as their communication. So they really they are part of this program, they are part of the education, and also even during the COVID-19, I think they can simply survive. That's the first area we do. Second area, really during this COVID-19 system, that really our church also involves in many activities. For an example, the dry ration programs that is also provided for the person with disabilities for their survival. So for their economic survival, as I mentioned, is $25 per month they receive. Even that is not enough for their medical services. So, and also I mentioned they are used to a one particular job. So the professional in one area. So when they ask them to move to another area, it is impossible. So the dry ration, that is social services also is going, it's really helpful for the area. Third area, it's really the social justice issue or the prophetic voice of the church, as well as the certain people personally as well as community, they are raising their voices really towards the person with disabilities. As I mentioned, the really quarantine systems and also the medical facilities as well as the vaccination issues. So much of prophetic voices is coming up, and also the government, they listen to them as then they are responding positively for their issues. And the fourth area is it's really in a personal way. Also, there are people and institutions also involved in their really to help them to come out from their social, economic, and cultural struggles. So really, the people, even though there are people who are working for the development of the person with disabilities toward this situation, but it's not enough, and also we haven't done enough. But they are there, and they need help.
Thank you, Reverend Stephen. Dear Nepali, sir.
Can you hear me? Hello. My microphone is not working. So can you hear me now? Can you hear me?
No, we can't hear you clearly.
Oh, very sorry.
Yeah, little. Yes,
Can you
yes,
hear
now
me
we
now?
can hear you.
Oh, sorry. Yeah.
Yes, yes.
Yeah, yeah. Okay, maybe the microphone has a problem. So, okay,
Problem,
if I talk about my personal life, so health and safety is the very important one. So in my family, we tried much to take care of child and arrange the safety, that mask. And so my daughter is the 18 years daughter, so she needs the uh, menstruation pad as well, and taking care and showering and so many things for to be the safety, to be safe from the coronavirus. So we tried much, but in fact this is the problem in entire other these types of children. So this one is the important one. So another one is the encouragement and to be prepared and to be stronger in this situation within the family. And we regularly encourage each other. To my wife, actually, if the child, if the daughter has a problem, such type of problem, actually this great big impact goes to the mother in the family. So my wife many times feel very depressed and upset and tension in the family. So encouragement is a very important one. So many times we encourage ourselves with the Bible verses, with the prayer, and with the encouraging each other. So as the Jesus said that is that because of our sin or his father's sin? So we always think that verse, that it is not the because of his father's sin and because of this it's one sin, but this happened to glorify the Lord kingdom, to show the God's power. And that these types of encouragement to each other and to family is the important one. So same way in my office work also, we just brought the strategy to share or to encourage each other within the group, within the families, and by the virtual as well as by the physical visit as well. And this is the important one, what I feel from my experiences. So another part from the official work, actually what we did is that we conducted the rehabilitation, tele-rehabilitation work. So that what is the tele-rehabilitation? That is from the distances, we have some rehabilitation expert, I mean the physiotherapist and our trained staff as well, and they provide the support and counseling to the people with disability and their families from the distances, by phone call, by first virtual, Facebook, in this way. And this is the one we have been doing that. And another one that in our organization, actually to put the situation in the action for rehabilitation, we have developed one COVID response guideline, actually for the support to the persons with disability from the work what we have been doing. So among that, there are 7 recommendations. So seven recommendations we have identified, and we have recommended to the other thematic areas or clusters of the organization. So in that, one is to identify that person's disability, mainly the persons who have severe and profound disabilities. And in every development activities, in every intervention, they should be in the first part, and they should be prioritized. And while selecting the beneficiaries, even though you conduct the education project, you conduct the library project, they should be in the core area, core beneficiaries group, and they should not be left from the benefit or every intervention or participation. So this another one is that the priority should be given to them, and another one is that accessibility. The whatever you do, even though you organize one relief support activities or meeting or any event, that should be the accessible to persons with disability from any places, any family. They should join or they should get that support easily, or whatever the information we develop or we prepare, that should be accessible to them. So in accessible perspective, and every activity or every program should be assessed and should develop the accessible intervention or priorities. That's one. Another one is as I talked before, the barriers are now increased because of this COVID situation, even the lockdown situation. That's why, so every project, whatever we do, that should be identified. The major three types of barriers. One is the accessibility barriers. So another accessible in terms of that physical or in terms of communication. Another is that the attitudinal. Another is that the policy. Whatever the policy, government or the announce the lockdown. So what the lockdown affect the person's disability's life, and how this increase the vulnerability to the person's disability, and that should be accessed, and that should be identified and assessed, and the action plan should be planned. So another is that special need and close support is the important one. So in development, sometimes we miss that additional need of the person with disability. So catheter in this lockdown, catheter is needed, and so medicines are needed. So the persons who need the medicine every day, that is affected. So these types of additional or special needs should be addressed in every project. And these types of suggestions, there are 7 recommendations we have given, and we have oriented and we have provided the training to the staff, and through that we have supported while developing their relief support and while developing their COVID response project as well. And these are the things in summary what we have been done in our project work. So out of this, I think what I said before, that encouraging to each other, as Paul said in the Bible, so we should not live encouraging to others. So encouraging to each other, and by virtual or by support, physical need support, by other encouraging word or prayer, and this is the important one to support each other. And that's why this is the one thing I would like to highlight here in the support.
Thank you, Bir sir. I would like to ask 2 different questions to Reverend Stephen and Juvin Versing. Different question. I would like to ask first Reverend Stephen. Like you mentioned that the person we have a visual impaired disability, they usually experience their seeing is touching. Like, and I've experienced that whenever I meet with those people, I usually take their hands and put mine on the cheek, and they see that I'm a big guy. The touching happening. You also mentioned about that. So how personally you are coping with this problem? How you are solving these issues? Issues of fear, issues of touching, maybe issues of spirituality, psychosocial impact.
That's a good question you are raising, sir. Tomorrow according to our Sri Lankan lectionary, we are going to celebrate or remember the Holy Communion, the Lord's Supper. So we remember the disabled body of Christ. Disabled body of Christ. So sometimes the touching coming out even from the Holy Communion. For personally, even a visual impaired people, they touch and see things. But this distance issue not allowing us to touch and see. Therefore, one area we feel that we are isolated from the society, isolations. Second area is fear and uncertainty. Third area, this is also kind of discriminations. So people also during this time, they interpret this COVID-19 with disabilities. They say due to karma, this disability issue created. But it's the right time to respond, not because of the karma, is community issue, then a community sin. Even COVID-19 coming out from the community sin. Even during this time, another issue coming up, the miracle and also sin. So here sometimes people interpret the disabled people and they see that they feel that they don't have sufficient faith. That's what they are suffering. Even the COVID-19 also interpreted out of this. So therefore, the Prakash pointed out the Paul's interpretations. 2 Corinthians chapter 12 verses 6 to 9, Paul says, thrice I prayed, but God never answered. But he said, your grace is sufficient. So more than the miracle, the grace is more powerful than the miracle. So here, even though we are isolated, so really we do not worry about that. We are not expecting a miracle. So that grace is sufficient for us. That is more powerful than miracle. So really this experience giving us to move from the judgmental model to grace, where we are plurality, part of the plurality of humanity. I can feel that, okay, I am unable to touch, but I am part of the plurality of humanity. So I am different from another person. Such a way I take it positively.
Thank you. Juvin, I have got a questions that, when you first met, when you were working in the COVID ward and you saw a children with intellectual disabilities or a person with disabilities, you were not prepared in the beginning, but how you solve that issues immediately, and what are the preparations like the hospitals are doing right now in order to receive the people with disabilities who have affected by COVID?
Thanks. So we often learn from our mistakes, no? So one of the things that we have now in place is when someone with a disability comes in, especially if it's someone with intellectual disability or on the autistic spectrum, we have reserved what's called, like, we have private rooms. Usually they're in the ward because they're on oxygen support, but we've reserved some private rooms for families, for persons with disabilities, and one caregiver to be with them. So to help the caregiver, we ensure that they have PPE available as well, to the extent that they need, especially the masks and the sanitizers and stuff like that, but so that the person with the disability knows they're not in it alone. So, I mean, that's about all we are able to offer, with the fact that the numbers that have come to us, we can't do more than that. You know how we've struggled for hospital beds and oxygen. So what we have done for some of these families is ensuring that one caregiver is with the person. Okay, I must also confess, it has its own arguments that have come both for and against, about the risk of exposing the family member to COVID. And but those are risks we talk with the families about, and it's a choice they finally make as to what they want to do. Yeah, thanks.
Thank you. Okay, before I ask the last questions, that's the solutions for the best practices we have done. As I'm involved with our Sundar Doka Church, we have also started the first disabled-friendly isolation center in Kathmandu Valley, and we have already served so many people with disabilities. And currently, we are also working in order to solve the needs that people with disabilities has, maybe diaper, catheter, or anything. And what I found, like when I visited one of the house recently who needed a food hamper bag, the food support, I found the child who had ADHD has been tied up on a rope so that a child will not run away from the home outside. And it has really broke my heart. But also it shows that how desperate the families are in need. So the questions I have for three of our panelists is, if you had to pick one thing that the church could immediately work on, what would that be? One thing. Would you have any advice on how to implement what you choose? A practical questions. And we are expecting a practical answer. Please, can we start with the Bir sir?
Okay, thank you, Vikas sir, for a very genuine point, raising the very genuine point. Yes, so actually now we are advocating to the any people, or especially to the development worker, as well as to the church people, to all the civil society, or all those who have a principle and moral responsibility. So first point is that we would like to see that they should see the people with disability in the needs. So every activity, every development initiation, what they do, and they should reach out to the persons with disability anyway, and they should see the vulnerability what they are facing, what we talked just now in the context. So this is the important one. So as I said before, that the encouraging to each other. Encouraging means just not only to say the beautiful words and to say that to counsel the people, but with the need, what they have, what they are in the crisis, what they need now, with the practical support is to reach out to these types of people is the important one, and and they should see that perspective. So another one is that is because you mentioned before, that accessibility is the important one. Another the important part. So the church, because the persons with disability are largely excluded actually in the churches as well as in the development activities at the moment. But because of this COVID situation, that is massively raised this point, or increase the issues or problems. And that's why. So 2 points: whatever we develop, we communicate message or communicate the message or communicate the information, and that should be accessible to all the persons with disability. Either they are the blind, either they are the deaf, either they are the persons with learning difficulties as well. So how they know what the Jesus said, how can be safe from the COVID situation, and how to be safe, and how to address this thing. This is the important one. So another point is that have we made our a church building as well as church fellowship as well as church meeting inclusive to the persons with disability? So this is the important one. So sometimes when we think that talk about the inclusion, that only people think about the building. Our church is inclusive. That's why persons with disabilities, they can come inside the hall and they can join the fellowship. But actually, are they be able to join in their real fellowship or in the meetings? Can they express? Can they contribute to the church activities, or can they lead the church fellowship, or can they join with every activity, the people how they enjoy? And this is the important part. That's why. So encouraging with the practical support to others and to create this environment is the important one. And another is that to make this possible, and church should be inclusive or accessible in terms of their participation, in terms of their contribution, in terms of their physical access to the churches or anything. This is the 2 points I would like to encourage and highlight here for the inclusion of persons with disability.
Thank you. I think Bill sir has clearly shared with us that instead of inviting people with disabilities, on this COVID time, can church reach out to the person with disabilities at their home with the support? That's very, thank you. We'd like to hear from Reverend Stephen. what is the one thing, like what's your advice that the church could immediately do with some practical steps?
Yeah, thank you. The church without disabled people is disabled church. So here I see most of the time, the majority of the disabled people, they are not Christians. So this is the first time church is facing this crisis to reach out very especially to the non-Christians regarding these areas. So in that areas, during therefore our task, as my brother mentioned, rather than inviting them in a particular place or a center, our responsibility to go there and also find their needs, to be with them, to encourage them, empower them, and give education and employment as well. Second area, the immediate is a long cry of mine, the inclusive language as well as the inclusive language in every areas, even in our liturgy, in our worship, even immediately we need to bring this aspect. And still I can hear people say blind, deaf, all these exclusive words in our liturgy. So we need to take very serious in our liturgy, even during this time. During this time, how much we give an important place for the person with disabilities in our preaching and teaching, even in our prayers. So that is very essential in my second point. Third area, in order to identify with the world, church should be ready to celebrate certain days in their liturgy, in their day-to-day as well. For an example, October 15th is a White Cane Day in Sri Lanka, and December 3rd, International Day for Blind People. So I think we need to bring these aspects, to take these aspects very seriously. Then we can move forward. Immediately, we cannot swim. We cannot swim. So from my point of view, immediately we can go, but how much, how far we are trained and educated ourselves for this issue is question. Over not solution will not help us.
Thank you, Reverend Stephen. We'd like to get the practical steps answer from the Juvin.
Thanks. I love how tricky the sequence of questions were. He asked us all possible problems, and then he tells us you can give one solution to all the problems we talked about. But I think, especially in the circumstances we are living in, the one thing that comes to mind is identify people with disabilities around us. So the church is not a body out there. We are part of the church. So are there people with disabilities in my apartment building? Are there people with disabilities in my neighborhood? You know, you start with that. That's the first thing that the church can do, is identify people with disabilities around us, talk to them and ask them what they need, and if possible, provide it. So it could be as simple as providing, like we talked earlier about, food hampers or provisions or transportation for vaccination or any such thing. I mean, I'll close with this example. I'll just finish with that. But if we can look at who are the people around me with disabilities, what are their needs, and what can I do? You don't have to wait for a huge grant or a fund to come. But it could be as simple as, if it's my neighbor, can I just buy vegetables for them or milk for them when I'm buying for myself? It's as simple as that, you know. And I'll finish with an example of what has happened here. Is we had a family who came in who were all COVID positive. One of them went into the ICU and they passed away. Now, the family couldn't organize a funeral for them because they were all positive. immediately the local church stepped in and they organized the funeral, regardless of the fact that the family could directly attend it or not. But it's those practical things that we can do. Step in, see where the need is, and do what we can do, what our hands find to do. Thanks.
Thank you. Thank you. We do have a lot of expertise right now in our webinar attending. We have a Reverend Asif from NCCI. We have a Jessica Richard from 19's Disability. We have a Mr. Lalin from NCCI India. And we have also Joseph Dinakaran, who is also a headmaster in Church of South India School for the children with intellectual disabilities. And maybe I just like to ask questions to Joseph Dinakaran, if he would like to maybe share 1 or 2 minutes how you are coping with COVID-19. What are the practical ways you are leading the school right now?
Yeah, hi. Thank you, sir. Thank you for the opportunity that you gave me in this webinar. I'm Joseph Dinakaran, and I'm the headmaster of the CSA School for the Mentally Retarded from Tamil Nadu. I'm happy to see Jubin. I met her in the Nagpur in 19's Disability. So I'm again happy to see her. And my experience about our children, we have 120 children with mental retardation in our school, and all were forced to send home during the last COVID period, that is at the time of like March 2019. All the children were sent back home because no one was allowed to stay back in our center. So what we did is like, we sent them home and we had only like 25 children, mentally retarded children who did not have parents. So we made them stay in our home. So all were sent home. And the great difficulty what the parents had is they were not able to take care of the children because they were all, every time they were left back in our center, in our home. But when they were suddenly sent back due to this COVID, they had a great difficulty of taking care of the children, especially during this lockdown. And again, they had a great difficulty of getting the daily bread because everyone is a coolie worker. They have to go and work for their daily bread. And with this mentally retarded children, they cannot go out to work every day, leaving them back home alone. So one parent has to stay home, the other parent has to go for work, and they had a great difficulty in running their home. So what happened, one experience I can share you, a very sad experience, is that there was a boy called Manoj who was a child with mental retardation. He was left back home, and both of the parents went to the work on a day in the month of July 2020. When they came back home in the evening, his son was dead, and he was found dead in a well in the village because both of the parents were out for the work because they had to go for the work for their daily bread. And this boy did not know what to do. He saw a group of boys playing in the well, and he also fell into it without knowing what to do. See, we heard this news and we wanted to help the parents. So what we did is we contacted the local churches here. There are 2 main churches in our city, Sivahasi. So we contacted the 2 churches, and in just 2 days, we got a lot of help from these churches. These churches gave us almost around like 1 lakh for buying groceries. We gave groceries for these 120 children families. When we gave 3 times like this, like July, and then we gave it on September, and then on January. And again, during this time, again in Tamil Nadu, it is very high, and there is again lockdown in Tamil Nadu. So like yesterday, like we gave again packs to this kind of grocery packs to the families. So these things were made possible by the churches. So churches in this particular area in Sivahasi, we have 2 mainstream churches with CSI. They helped us a lot in helping our children with mental retardation. And as you were, sir, you were talking about the children were tied up in their home. We had a boy like that. He was tied to the tree in his house. The villagers told his parents to kill him because they did not want his parents to have this kind of a boy. The whole village was against the boy, and they wanted to kill him. So again, we got the news through some of our people around there. We went there directly, we rescued the boy, and we brought him back to our center. He's safe here. So this this mental retardation children were like, when compared to other kind of disabilities, they were more affected during this. Again, there were some kind of misbehaviors with the girls who were in the town, and we had so many cases coming to our school asking, so many police people coming and asking us to take care of this case, and we had all these kind of difficulties during this COVID period. And as I said, churches were the main thing, who were the backbone of our school. They helped us a lot, and we thank the churches. And also, I thank you for giving you people for giving me this opportunity to share our experience. Thank you.
Thank you, Mr. Joseph. You know, until a church does not value that each person with disabilities also have born in this world with wonderfully and fearfully by the will of God. Until we does not value people with disabilities, they will always be marginalized. Their voice will never be heard, whether in church, in our community, or in our country. We do have a few questions for our panelists. I think one of the question is suggestions. The question is for Bir Nepali sir, is it possible to share the 7 steps that 7 recommendations that United Mission to Nepal has developed with the wider community in South Asia with our churches?
Okay, thank you, Vikas sir. And actually, I would like to thank Jessica actually for raising this point. So I respond in chat box as well to this point. So the guideline, actually what we developed, having the close coordination with other like-minded organizations, other organizations under the association of INGOs, that there is one network, we call that Disability Working Group. And with that group, we used to share each other or encourage each other what we have been doing, what the practices we have been doing. That is the strategy we can apply within the church as well, in small clusters, and within the small team also we can organize these types of things. So, sorry, my phone is disturbing much here. And so, okay. So another, and so that guideline, what we prepared together and sharing each other or learning, and I can share these to Vikas sir, so Vikas sir can share to other community also. That will be no problem to us. So what the 7 point talks about, what I shared a little bit main points before also. So that entirely the 7 recommendations talk about that we should reach out to the persons with disability first, and to identify their need, and to plan whatever we plan, we should plan with them. Actually, sometimes we talk that we should participate persons with disability in our development activities, but this recommendation talk that we should join with the persons with disability to develop the inclusive plan or inclusive activities. So this is the important part, and we should go to them. So sometimes to make the accessible environment, we make the relief center accessible. That means that whatever we distribute from the center, whatever we organize, the vaccination places, in the places, it's inclusive. That is good initiation, but have you thought about that, whether the person with disability become able to come to that sport or not? That might be the barrier at the home, that might be the barrier at the roads, that might be barrier in the communication system. So there are lots of things we should think differently. So there are lots of things we should be thinking. That's why from these are the points we should think, and we should reach out to the person with disability whatever we do. This is the things we have recommended, and actually we have recommended to the development worker. Even we develop the education program, even we develop the health program, have we thought in different way this perspective? And these are the things we are recommended to the development workers or organizations or even churches also. So there are the major strategic recommendations. So these are the things. Yeah. I can share this document.
Yeah, I will receive that document, and I will be putting those documents on our South Asia Christian Youth Network Facebook page. So you can all get those documents from South Asia Christian Youth Network Facebook page. I have got probably a last questions. And the last question is, in the midst of all these problems that we said, all in the dark, is there any story that we like? Is there any story that we have supported any family with disabilities and their life has transformed? So this question is for our panelists, dear sir, Juvin Verghese and Reverend Stephen. Do you have any stories the church has impacted on any people with disabilities currently during this pandemic?
Yeah, because it's a story from my parish, it is Christ Church in Kandy. There is a paralyzed person, and also going through a mental agony because of his physical situation. He was isolated by his wife as well as children. So physical pain as well as mental pain. So, and also last week, 2 weeks back, he was admitted in the hospital for the antigen rapids and the COVID PCR checkup. During that particular time, he was so down, and also there were, as I said, no proper quarantine system for disabled people. So really, he phoned me. Then I went there. It's really doctors, they didn't allow me to enter into the hospital. Somehow or other I managed. Then I encouraged him. I prayed with him. And also, really, I helped him. I spoke to the doctors regarding these issues and everything. First of all, he received some identity. I said, Father, you are with me. Secondly, he received the strength, some sort of mental relax he has received. Third area, finally, no positive. It's the final issue also sorted out. So, from my experience, what I can say, our present is necessary, first area. Then identity. We need to identify ourselves with a person with disabilities. Then our identity and our presence really will help them to empower from their physical and mental painful experiences. Is my experience.
Juvin, you have something you want to share?
Sure. I think I'll expand on what I had mentioned earlier. So in our ICU, we have a small ICU. We have a 10-bedded ICU. So every day over the last month, about 3 or 4 people were dying every day. And what would happen was, after the death of the person, we have to cover them up and put them in body bags in a way that it is safe for the families to be able to transport the body. And they go directly from the hospital to the place, to the funeral place, wherever it is. They can't take the body home. And what would normally happen was, as the body would come out of the ICU and be put into the ambulance, the family members who would be there, they'd all be PPE kitted. They wouldn't touch the body even, mostly. They would all step away, and it would have to be the hospital staff who moved the body from the stretcher to the ambulance. That's the general procedure, and we are used to it. We see the family stepping away, and we have to stand in the gap and do that bit. But what has been beautiful is to see how the church has stepped in and what a testimony it has been to all the people around. Because when, like I mentioned earlier, we had a death in the ICU and their family members were unable to make it because they were COVID positive also. The local church coming in, PPE kitted, but they came in, they received the body, which was surprising for us. We thought, they would be scared to touch the body, but they received the body, they sang hymn over the person, they prayed, and they took the body. And it was such a beautiful testimony to everybody else who was watching, because they turned around and said, why are these people doing it? It's not even their family member, and then to talk about what the church can do and how the church supports. They saw the practical aspect of the love of Christ being shown. And I think to everybody who was around, for all of us staff, it was so powerful to watch that happen. I mean, for us, it was encouraging, but for all the others who were there who do not share the same worldview, they were challenged by what they saw this church come and do. So yeah, thanks.
My last questions to our panelists, then we will not be taking any more questions now. Because this is so issues, our main intention was to make aware about disability issues in South Asia, and we will continue to talk about these issues in coming months. I've got a question here. This COVID-19 has also, you have already seen maybe on the questions that due to COVID or a post-COVID issues, with many facing at mild to severe disabilities, such as black fungus cases causing eyesight issues. How can we help such individuals as a community and a church? Reverend Stephen, would you like to answer this question, please?
Will you be able to repeat the questions? I'm not getting properly.
Due to COVID or a post-COVID issues, with many facing at mild to severe disabilities, such as black fungus cases causing eyesight issues. How can we help such individuals and their families as a community and church?
Yeah, first of all, really, this is visually impaired situation. I'm also going through. Really, that will affect persons, parents, as well as community. I totally agree with the point. So how can we respond is one, really the words of encouragement and empowerment we receive from our parents, community, as well as in our schools. So I received many encouragements from my school teachers, and that really helped me to come up. Second area, so we need to challenge the social discriminations. That's really, it's not an easy task. Really, we have some proverbs and even some Bible passages also to disturb and also to disturb the person with disabilities. Sometimes we use the Bible verses also really to judge person with disabilities. Whose sin? Either his sin or the parent's sin. More than the sin is his community sin. Community sin. So we need to liberate, we need to develop this kind of interpretation that really will help and come out. Third area, it's really as I mentioned in the beginning. So more than the miracle, we need to emphasize the concept of grace. That grace is more powerful than miracle. Even I am not expecting a miracle from God. I'm expecting his grace. I'm living because of his grace. So we need to develop the person with disabilities, that we have to we need to develop that spirituality. The fourth area, even my God also who is blind. Therefore, I need to have a new understanding about God and new understanding about Christ. That will help me really to understand others in a different way. Even Jesus, he himself, before the crucifixion, he asked, who hammered? That's a question generally the visually impaired people ask. So my Lord and Savior, he became blind before the crucifixion. Even he himself, immediately after the resurrection, still he remains with his wounds. For what? He identified himself, once again, person with disabilities. The one who healed many people remains with his wounds. That is my spirituality. So therefore, this kind of spirituality is necessary for their survival, for our survival. So we thank God for the different understanding.
Thank you, Reverend Stephen. Same question I'd like to ask for the Jubin. Like, how can we help church and community? We can support the person who have disability recently.
I think first to recognize that disabilities that have arisen due to COVID-19 situations. For example, we've had patients with black fungus with us here. And the journey they have made has usually been traumatic in itself, because they would have come into the ward, gone into the ICU, survived the ICU while watching others around them die, then come back into the ward again. By then they've picked up black fungus. Yeah. So the whole journey has been traumatic. To recognize the trauma that they have been through and to be around them as they deal with even that. So on one end, while they're grateful that they survived, on the other end is this thing of how do I survive not being able to see, you know? So the support they need to make that transition, that is one main thing that we need to do, just stepping in practically for them. The other thing is also looking at, and I've mentioned it again and again, is look at practical things for them, ensuring that they have access to disability services. They may need disability certification. They need to get onto disability pensions. They need to look at livelihood options now, because suddenly all of that has changed, you know. And even within the family, they might have been the primary breadwinner, and that situation has changed. So to consider all of that and to step in practically would be things that we would need to educate ourselves first if we don't know about it, and then to walk alongside the family. Thanks.
Thank you so much. Thank you. I would like to, on behalf of South Asia Christian Youth Network, we'd like to thank our panelists. Thank you so much for your insight. Thank you so much for your expertise, experience, and we'd like to thank you for what you have been doing for persons with disabilities and their families. Thank you for raising awareness among our churches. Thank you. It's not easy to wake a church, but thank you for your continued support on awakening churches, making them realize that persons with disabilities are also a part of church. I would like to again quote the Reverend Stephen said, "Church without a disabled is a disabled church." And he also quoted, "Grace is more important than a miracle." Amen. So if you'd like to know more about disability ministry, how church can respond to disability, we have, please, Sri Lanka, you can connect with Reverend Stephen. If you are in Nepal, we have a Nepal Christian Disability Network. You can connect Bir Nepali sir and myself. If you are in India, you can connect with NCCI IDEA. You can connect with Engage Disability Network and Emmanuel Hospital Association. Thank you so much for joining. Thank you.
Thank you.
Thank you. Before we end up this webinar, Dr. Indira has requested some few minutes to share her story. Dr. Indira, over to you.
Thank you so much. I was really felt happy to share. One of the person in the Hyderabad hub who is a physically disabled, and his disability conditions are worsening day by day. He knows during this time, his father went to US, so he was alone. So he started, feeling that he's unable to walk. He was looking for a wheelchair. So he posted his request in the group, Hyderabad Engage Disability Hub, in the group, that I am sending some quotations for a electric wheelchair. Please pray for me to get some support from anywhere. So he is also approaching some people. Then when I saw that, I got reminded one person in the Telangana government who is in the good position. He's assistant director or something in the Disability Welfare, Department of Disability Welfare, Telangana government. I have just sent a chat to him that there is a need. Is there any benefit from the government side? Is there any scheme that one of the person is in need of this COVID situation, a wheelchair, electric wheelchair? Then then this person also I told, can you contact to that assistant director? Then he said he can't follow my words because he's having some he's going on, his voice is not clear. So sister, can you talk to him because he can't follow my language? Then I told, no, it is, if you talk only, he will understand more that how much you are in need of this help. Then they both talk. I don't know what happened, as grace and miracle happened, and suddenly I received a call from this friend. Sister, I received by post an electric wheelchair for which I was dreaming of since long, and I'm praying. It's such a miracle. So I'm happy and thank you for the network. So I didn't do anything really. It is God has done. I just put in a chart that connected to them and he was blessed. So I felt like sharing this, how the church and the network and the connectivity is, more of work to get into the lives of the PWDs. Thank you.
Thank you, Dr. Indira, and also Joseph Dinakaran for sharing your stories. And also many thanks to our wonderful panelists, a set of caregiver, a person with lived experience and a perspective from an expert. It was such a great, rich, perspectives on the topic. So thank you, everyone. And also thank you to Bikas Dai for moderating the session so well. So we are towards the end of the webinar. We would like to hear your feedback on the webinar today. So we will be launching a poll. Could you please take a minute to attend these 6 questions? Also, in the meantime, I would also like to inform you that the network, the South Asia Christian Youth Network, has been organizing this monthly webinar. So we will again be holding another webinar on July. So normally we would conduct on the first Saturday of each month. So for more details, please stay tuned to our social media page. We will be updating the topic and also the panelist and also the moderator. So please stay tuned, and thank you very much for joining us tonight on this webinar.
Ending the recording.
Oh, yes.
Thank you, dear sir. Thank you, Reverend Stephen. Thank you. Thank you, Juvin. Thank you a lot for accepting our request and speaking. It means a lot to us, for South Asia Christian Youth Network, and me personally. Thank you.
Yes, thank you, everyone.
Thank you. Bye.
Bye-bye. Good night.
Good night.
Thank you.
Yeah, so if you have any suggestions on the topic that you would like us to cover in the next webinar, please take a look at our chat box. You can email the topic in our email, or also you can drop a message in our Facebook or social media, our website, I'm sorry. Yeah, thank you. Good night, everyone. Bye-bye.
Bye-bye.
Good night, all. Thank you. Bye-bye.